While a new study finds fewer young people are dying of cancer, colorectal cancer is now the #1 cause of cancer-related deaths for Americans under the age of 50. The research from the American Cancer Society analyzed U.S. cancer mortality rates from 1990 through 2023 among younger patients. It found overall cancer mortality in that age group went down by 44% over those 3 decades. But rates of colon cancer specifically have been steadily increasing, rising from the 5th leading cause of cancer deaths in 1990 to the 1st in 2023. Dr. Arif Kamal joins us now. He's the Chief Patient Officer for the American Cancer Society. Dr. Kamal, thank you for being here. What is causing the rise in deaths among younger people?
Yeah, well, it's important to recognize, particularly for colon cancer, that our colon as an organ gets exposed to everything we put into our body, right? Everything we put in our mouths comes through the colon. And so if we look at risk factors, the colon sort of gets exposed to a lot of different things. We know that alcohol, low fiber intake, ultra processed foods, particularly red meats, are all associated with increased risk of colorectal cancer, as is being overweight. And so, it's one of those things as we see this disturbing trend, it's an important time to remind ourselves that there's changes we can make in our everyday lives to reduce our risk.
So, what are the current guidelines on how early and often someone should screen for colon cancer?
Yeah, so we at the American Cancer Society highly recommend people start at the age of 45 doing colon cancer screening. And typically when people think about that, they, think about a colonoscopy, which is a very good way of doing that. But there are several different ways to doing screening. And we believe, the best type of screening is the one that gets done. So if you're 45 or higher, the chance that you've actually are up to date with your cancer screening is only about 25% for people between the ages of 45 and 50. But we know that cancer found at those age groups are 3/4 of them are metastatic or very advanced. So it's a really important time to be up to date with screening and to get the one that you can get done. So if you can't take a day off from work to get a colonoscopy, use one of the at-home tests. Talk to your doctor about all the different options that are out there.
And finally, doctor, as we noted, overall cancer deaths among people under 50 are declining. What's behind that?
Well, what we're doing is working. It's three-pronged. The first is prevention. The largest preventable things that have happened over the last 30 years is fewer people are smoking now than ever before. That includes teenagers and people in their 20s. Second, we've got screening that's really working, and a lot of people are doing that. Colon cancer screening, breast cancer screening, skin screening, et cetera, is really important. And lastly, a lot more treatments than we've ever had before, and particularly ones that are tolerable over long periods of time and targeted to particular receptors that tend to show up in people in cancer at younger ages.
Dr. Arif Kamal, thank you.
Got it.